This month is all about modifications for ankles. So we're going to talk about some different poses that we find often and how to modify them, say for someone who has had ankle surgery or multiple ankle surgeries and now has scar tissue, or they're unable to stand due to balancing issues. But a thing I do want to say is when we're modifying these poses, which is wonderful. We want to be able to modify these poses. But when we are taking the balancing out of things like tree pose, we want to make sure that we put that in the class in another way. So here we're balancing, right? We can be here, and there's a whole other thing going on with the body when we work on balance. And so it depends on you or who you're teaching. But we really want to make sure that we incorporate that in another way. Either by, you can even stand in mountain with the eyes shut, depending if someone's suffering from something like vertigo and that's the reason they can't do the single leg standing poses and things like that, then we modify in different ways. But I wanted to make sure I included a little bit about the importance of balance and that how we want to make sure we have a well-rounded class regardless of what we're modifying. So just ideas on how to do that. Sometimes we do, standing poses or seated poses or reclined poses with our eyes shut, and sometimes even just standing if someone is off balance. That can be a challenge. So you can incorporate that aspect in different ways. Today we're going to talk about tree pose. So instead of doing it standing, you could always modify if they're okay for a little bit, just to have the toes, the ball of the foot down, and then the heel up on the other leg. But that way there's a little bit of balance going on because this foot isn't really bearing as much weight. But if the ankle is really sensitive, you could always have them do that or lower and then come back down and tap. However, if there is more severe sensitivity or recovering from a surgery or a fall or something like that, we can modify to what's called fallen tree. So basically, we're going to come onto our mat, onto our back. And you can use this strap to kind of hold your leg there, or if you want to use this in a whole different way, you could see if you're trying to improve, say, that lateral rotation of the hip, you can use this in a way to see how much progress you are making. So there's just different ideas here, different options. So depending on how far out your leg will go, now I know mine will go to about here on this side, so I've propped it up with the blanket because we want to be in the pose, but we don't want to be forcing anything. So I'm going to bring this leg straight. Now notice that I have flexed. I've dorsiflexed my leg that would be my standing leg, this one. So the other option too, you can do this against a wall. You don't have to flex that foot. If that ankle has an issue, just leave it out. You can also put a block at the end of the foot, or a blanket or something, so that it sort of resembles the floor. So we're giving them something to push off of, to hold. You're not pushing off it, but it just offers some, it's more of a mimicking thing. A little bit more realistic if you want to really engage that leg, excuse me, like it's down. So the other thing we can do is we can take a strap, we just hook it on that foot, and you don't want to hurt. Obviously, you don't want to pull too far. We're going to stay off the knee, but you can work on bringing that up a little bit higher. Like for me, this is uncomfortable to do standing. I'm not quite that flexible. So this is something I could work on in this position. Say I have suffered an ankle injury. Now, we don't want to wrap a strap around a foot with an ankle injury. I wouldn't recommend that. But if you're modifying just for practice, you could do that. So here, we can bring the hands to the heart. We could bring them up over the head. We could bring them out to the side. Whatever feels comfortable. Rest them on the belly. We can omit this altogether and let that foot just relax on there. Maybe if they're recovering, that feels good to have some support there. But overall, we're maintaining the integrity of the pose. We're still forming the shape. We're just doing it in a modified